Hello, I'm Dr. Sascha Sajer, IFM board-certified physician in integrative and functional medicine and founder of the Revisalute longevity line. For more than 2 decades, I have worked internationally at the intersection of rehabilitation, sports medicine, and advanced preventive medicine, serving as a chief physician for both inpatient and outpatient care. My focus is precision longevity, identifying root causes, optimizing human performance, and redefining what it means to age. Through science-based personalized strategies, I help individuals not only extend lifespan, but elevate health span, with strength, clarity, and vitality. In my clinical work, I focus on regenerative medicine, cellular health, and preventive strategies designed to stabilize biological systems before disease develops. In this series, I will introduce selected approaches from modern longevity medicine and explain how they support long-term health and resilience. The information presented in this video is for educational purposes only and should not be considered medical advice. Some of the substances discussed, including peptides and bioregulators, may be classified as experimental or not approved for routine medical use in all countries. Their safety and efficacy may not be fully established. This content does not replace medical advice, diagnosis, or treatment. If you are considering any of the approaches discussed, please consult a qualified healthcare professional. For further details, please refer to the full disclaimer below. Cognitive aging is rarely a sudden event. It develops gradually through chronic inflammation, mitochondrial decline, vascular changes, and circadian disruption. The brain depends on stable neuronal communication, efficient energy production, and balanced immune signaling. When these systems become dysregulated, we may observe subtle cognitive changes long before structural pathology appears. Certain peptide-based approaches aim to support neuronal resilience and regulatory stability. The objective is not stimulation, but preservation of cognitive capacity, neuroregulatory balance, energy efficiency. Sleep plays a central role in this context. Deep sleep supports glymphatic clearance, synaptic recalibration, and hormonal regulation. Supporting circadian stability therefore contributes directly to long-term brain health. Cardiovascular aging often begins with endothelial dysfunction. The endothelium regulates vascular tone, inflammation, and oxygen delivery. Over time, oxidative stress and chronic low-grade inflammation reduce vascular elasticity. Rather than focusing solely on blood pressure values, integrative longevity medicine evaluates vascular integrity at the structural and regulatory level. Bioregulatory strategies may support endothelial repair mechanisms and microvascular function. The goal is to maintain adaptive capacity within the vascular system, vascular resilience, regulatory coherence. The liver is central to detoxification, lipid metabolism, glucose regulation, and hormonal balance. Chronic stress, environmental exposure, metabolic overload, and inflammatory burden gradually impair hepatic regulation. Functional decline of the liver often manifests subtly through fatigue, metabolic instability, or hormonal imbalance. Bioregulatory approaches aim to support hepatic regeneration and metabolic resilience. A stable liver contributes to systemic equilibrium across immune, endocrine, and metabolic systems, systemic integration, metabolic stability. Longevity medicine does not treat isolated organs. It seeks coherence across interconnected systems. Brain function influences cardiovascular regulation. Liver metabolism influences hormonal balance. Immune signaling influences all of the above. Supporting regulatory stability in one organ system often benefits the organism as a whole. Targeted organ support within an integrative framework aims not at temporary enhancement, but at long-term resilience. In the final episode of this series, I will discuss a more advanced systemic intervention within the Revisalute longevity line, plasmapheresis.